Hi everyone. We are thrilled today to welcome author of the Editor's Choice article, Dr. Sen, all the way from South Carolina, to our video program. Thank you so much for joining us today. And could you please tell us a little bit about you and your work, Dr. Sen?
Oh, absolutely. So my name is again Souvik Sen. I'm the chair of neurology at University of South Carolina School of Medicine, also with the Prisma Health, which is a big health network in South Carolina. So I a little bit background about myself. I'm a stroke neurologist. So although the paper is related to migraine and stroke risk, but I'm coming from a background of stroke neurology as well as public health. So before South Carolina, I was in North Carolina, University of North Carolina in Chapel Hill, where I got the privilege of being acquainted with this large study called the ARIC, atherosclerosis risk in community. And that is where this comes from. Okay, so that's a little bit about myself. And then this study was done by quite a big group of people. Okay, and I'm very proud. Like the first author is McCain, who's currently doing a neurology residency at Case Western. Okay, there is Michael Parrish, and then very important, Dr. Melikov from Israel, okay, who actually first suggested to me, like, hey, why don't we do this? You have this data set. So I've been publishing on migraine and stroke risk, and Dr. Melikov sent me a quick message one day saying that, hey, why don't we look at this? Why don't we build a stroke risk? And that's how this idea really started. And there are others too in this paper. So
Really amazing collaboration. And thank you so much that vascular issues in headache and migraine got tackled in this article. Could you please tell us a little bit about methods?
absolutely. So this is part of a big, large study called ERIC again. Okay. And in this study, it started in the mid 1980s. Okay. And it originally started with 15,792, quite a big size in the United States, having predominantly two races, okay, white and African American. There is also some small numbers of other races as well. And this study, every 3 years approximately, has a visit. Okay? And on the third visit, they were actually asked questions about migraine symptoms and details. Okay, from that, we were able to extract migraine and migraine with aura and without aura data from that. And they were about, well, we were able to classify using the ICHT3 criteria. We were able to identify almost 1,500 subjects who actually had migraine with or without aura. And of them, we had full data on about 1,485, which is quite a decent data set. And with this subject, we have almost a 20-year plus follow-up on whether they had stroke or other cardiovascular conditions. So that's where this data set comes from. It comes from 4 counties in the United States, distributed mostly along the Southeast and Midwest. Okay. And essentially all that information one can easily obtain from the ARIC website, but it essentially is a very good sample representative of the United States population.
Excellent. And SCORE was developed. It really greatly represented in graphical abstract and publication. What was the result of the study?
Oh, absolutely. So we developed the score. We kind of put a large net as to what we would put in the score that included stroke risk factors, medications, and migraine characteristics. And we were able to narrow it down to about 11 factors, which were important. And it started off with about 6 vascular risk factors, which were age, race, hypertension, diabetes, BMI greater than 30, and atrial fibrillation. So those were the 6 vascular risk factors. And then their medications, 3 of them stood out very prominently. Intake of steroids on a chronic basis, opioids, and SSRIs. Okay. And then last but not the least, the migraine characteristics. Surprisingly, we all know aura is a risk factor for stroke when somebody has migraine. But interestingly, duration less than 5 years.
That's
And
amazing data.
yeah, and to me, initially I was a little bit surprised, but it turns out that it makes sense that somebody's developing headache in a short span of time. They all might have a higher risk than somebody's had migraine since childhood. And this was very impressive. And then we were able to actually, based on some statistical methods, we were able to assign points. Okay, and the highest point was somebody who has had diabetes. They got 3 points. A lot of them got 2 points, including race, hypertension, atrial fibrillation, steroids intake, and then also use of opioids and the presence of aura. So they got 2 points, and the rest got 1 point each. So with this, we were able to develop a score which was ranged from 0 to 21. And just to give you an outset, this is a middle-aged population. We're not talking about young stroke, young patients who are also at risk for stroke or migraine, but this might not apply to them. This is the average age of this population at the time of migraine diagnosis was 58. So it's a little bit more than 55, which itself is a risk factor for stroke. Age is a risk factor for stroke. And then what we did was we used that information and tried to see like who was the highest risk. First, we divided them into 4 quartiles. And it turns out that the higher upper 2 quartiles were at the higher risk. Okay. For example, the quartile number 3, 5 to 7 score. Okay. They had a risk of almost 3 times. Okay. 2.7 odds ratio. And then when you moved on to the highest quartile, 8 to 21, the risk climbed up to all the way to 6 times. Okay. So very nice kind of a response effect as to higher the score, higher the risk. And then we're also able to kind of follow this patient, as I said, for about almost 20, 25 years at the most, okay? And in that, what we found was if you used a cutoff of just 5, okay, greater than equal to 5, that itself translated to a risk of almost 4 when adjusted, and when you adjusted for all the factors, it was at least twice. So just using this 5 as a cutoff, as high versus low, was a good kind of cutoff to use. Then we were also in this study able to compare it with some of the traditional stroke scores. We were actually able to compare it with very widely well-known Framingham risk score, and we found that we call this as Mars score, Mars Plus, had a little bit slightly better performance even than the Framingham risk score. Now, to point out that the Framingham risk score needs a lot of assessments, okay? There's assessment for blood pressure, there's assessment for LDL cholesterol. So it's not something you could easily obtain at a bedside without getting some test results back. And this one does not have any tests. It's all based on bedside questions. So to me, I think it has a little bit of more of a practical validity, pragmatically used in the setting of even a primary care's office. So very proud about it, but I think also methodologically, we obviously have shown that it is a good score. Right now, what we're doing is we're in the process of validating, because before using into the clinical era, we need to be able to validate in other data sets. So
You know, one of the questions which comes up often is about hormones and migraine with aura. Did you take a look at this population?
oh, absolutely. So that was something we looked at. We looked at hormone replacement therapy, and this is all mentioned in the paper. To our very pleasant surprise, those who were on hormone replacement therapy were not necessarily at high risk for stroke. So, and then
Thank you.
yeah, we definitely looked at that, and that was surprisingly because in the earlier times, it was reported that HRT might be protective, and I think this shows at least it shows it's not a high risk for stroke.
That's amazing data. Thank you so much for giving us this information. It's a lot of food for thought. And as a conclusion and future direction, it seems like we will be expecting more on practical recommendations from the group. Is that right?
That is absolutely correct. And we are trying to validate it out of in two locations. We are again trying to validate it with Dr. Melikov in Israel, and we're also trying to validate it here in Duke University. One of the authors, Sweta, she is the director of the stroke, the headache program at Duke University. So we are in the process of doing those validations right now.
That is so exciting for all headache community. Very grateful to our editor of Cephalalgia and Cephalalgia reports, Dr. Sacco, and congratulations to Dr. Sen and whole amazing group for Editor's Choice article. We really hope to see next publication, all headache community, and from me and my colleagues. Thank you so much.
Thank you.